Now let's start with the second section of our lecture, airway obstruction. We already talked in the first section about the different types of foreign bodies that can cause airway obstruction, and especially in children, and which are most likely prone to the airway obstruction by the foreign bodies, and what are some causes in the adults also, even though it's not very common. But now in the second section we will discuss the clinical features which are produced by the presence of foreign body in the airway of passages. So the features produced by the presence of foreign body are divided roughly into three phases. In the initial period, how it affects the airway passages. Then there is a symptomless period when no symptoms are present. That is also one phase. And then in the third, the late symptoms produced by the presence of foreign body in the airway passages. So we will cover all these one by one, which is the initial period, symptomless period, and then the late phase or late symptoms produced by the presence of foreign body. So the clinical features produce the initial period. What's the initial period of foreign body? Usually they have choking, gagging, and the wheezing produced by the obstruction of the airway passage by the foreign body. So initial right away response is the choking, gagging, and wheezing, especially if the foreign body is big enough that it is causing obstruction right away. Then it lasts for a short time. Foreign body may be coughed out. So once it is causing the gagging and choking, naturally the person tries to cough it out, or if somebody is present at the spot, they want to do the back thrusts, and they can cause the coughing up of the foreign object out. So this lasts for a short time. It's not for a long time, because patient cannot tolerate it for a very long time. If the obstruction is severe or complete obstruction without the help or without the coughing up of the foreign body, it can cause rapid death. So foreign body may be coughed out, may lodge in the larynx, or may lodge in the tracheobronchial tree, depending on the size. If it is large, I already mentioned, it will be in the supraglottic region. If it is small, it can go and it can lodge in the larynx, lower down in the subglottic region, or in the trachea or bronchi. So that's the initial period associated with the choking, gagging, and the wheezing. Then symptomless interval. Symptoms, when no symptoms are present, it's in this the why symptomless. Now the respiratory mucosa adapts to the foreign body present in the passageway. So mucosa adapts to the foreign body, to the presence of foreign body, and the initial symptoms disappear, which was the choking, gagging, wheezing, and now it's a symptomless period following the initial period. It varies again depending on the size and nature of the foreign body. May last few hours or few weeks. So symptomless period is the period when the body adapts to the presence of foreign body and no symptoms are produced in this phase. Then later symptoms. After the initial period, symptomless period, then we have late. You can see on the x-ray, you can see the foreign body very clearly. It's present in the chest. This is also the obstructed airway by the foreign body. So later symptoms produced by the foreign body, we have the symptoms produced are mainly by the airway obstruction. So late symptoms produced by the foreign body are mainly by the obstruction of the airway caused by the foreign body. There is inflammation due to foreign body occurs. It takes time for inflammatory reaction to occur. That's why we have symptomless phase. Now inflammatory reaction occurs, inflammation occur, and there is also trauma induced by the presence of the foreign body. Naturally is causing ulcer. It is causing scarring because of the foreign body, presence of the foreign body. And it depends on the site of the lodgement also. So these are the phases. We have initial period, symptomless period, and then the late symptoms associated with the foreign body. Next, the laryngeal foreign body. If the foreign body is present in the larynx, here you can see the laryngeal foreign body. Total obstruction of the airway occurs, leading to sudden death. If, as I mentioned, sudden death, no coughing up with the cough, then it can cause sudden death because of complete airway obstruction. So total obstruction of the airway cause sudden death. Unless resuscitative measures are taken, unless help is present, unless CPR is performed, basic life support is given, this can cause sudden death. Partially obstruction caused by the foreign body. Usually there is discomfort or pain in the throat present if it's in the larynx. Hoarseness of voice, croupy cough, aphonia and dyspnea is present, difficulty in breathing. Aphonia, absence of voice, is present because it's in the larynx, which is the voice box or sound box. There is wheezing and hemoptysis. Blood in the sputum is present if there is foreign body in the larynx. So again, depending on the size, it's very important. If it's causing the complete obstruction, it can cause sudden death. In case of partial obstruction, depending on the size of the foreign body, it can cause pain, hoarseness, dyspnea, aphonia. All these symptoms are associated with the partial obstruction of the larynx. Next, the tracheal foreign body. If the foreign body is present in the trachea, if it's sharp foreign body, here you can see sharp foreign body, it's like a hairpin. You can see very easily it's like a hairpin. Again, lot of females, when they do use the hairpin, they can hold that pin in the mouth, between the lips, in the teeth, and when they hold it, sometimes accidentally they can aspirate that hairpin. This is the hairpin, which is the sharp foreign body. So sharp foreign body produce cough, cause hemoptysis. There is blood in the sputum because of the sharp object, cause very rapid damage to the tissues, soft tissues. So cause hemoptysis. Loose foreign body, like seed. Again, this mechanism is the same like we talked about the peanut. Seeds get swells up and cause obstruction and congestion. So loose foreign body like seed move up and down the trachea between carina and undersurface of vocal cords. Cause audible slap and palpatory thud. So these are the features produced by the loose foreign body like seed. It can move up and down, and these cause the audible slap. It can produce the sound that is audible and palpatory thud. Also, asthmatoid wheeze is also present, which is present, and the asthma, loud sound produced by the inhalation during breathing, and best heard at the patient's open mouth. So this is the tracheal foreign body. If it's sharp object or if it's loose object, how it can be differentiated. So we have cough in the sharp, it can cause hemoptysis. Loose like seed, it can move up and down, cause audible slap and palpatory thud, and then we have, it can cause also wheezing. Then bronchial foreign body. If the foreign body now reaches the bronchi, what happens? Most foreign bodies enter right bronchus. Right bronchus is wider as compared to the left, because on the left we have the heart also, and it's little narrower as compared to the right. So right bronchus is usually affected because of the widerness of the right bronchus, in line with the tracheal lumen, in the straight line of the trachea. Total obstruction, lobar or segmental bronchus causing atelectasis produce check valve obstruction. Now, the check valve obstruction, we will go, if the foreign body is in the bronchi, it can cause the check valve obstruction. Check valve obstruction can cause obstructive emphysema. Here you can see ingress only, and then both ingress and egress, in ingress only and then egress stopped. So this can cause the obstructive emphysema. So check valve obstruction with the bronchial foreign body, only ingress of the air. So here only ingress, only air can go in. Ingress of the air is present, and this can cause obstructive emphysema here. So foreign body in the bronchi cause check valve obstruction. This check valve obstruction can only cause the inflow of the air, ingress of only, no outgress or egress here. Egress is absent, cause obstructive emphysema. Emphysematous bulla may rupture. So it can cause obstructive emphysema. The bulla that is formed as a result of emphysema, it can rupture and cause the pneumothorax. Pneumothorax is the presence of air in the chest, and when the bulla are ruptured, it can cause pneumothorax. So this is the bypass valve. Bypass valve is both, we have ingress and egress. So if there is bypass valve, ingress is present, egress is also present. In check valve, we have ingress, no egress. And then stop valve, it completely stop, no ingress, no egress, and this can cause obstructive atelectasis here. The obstructive atelectasis. So this is the mechanism of bronchial foreign body. Depending on what is causing, it can cause check valve obstruction, or stop valve and open valve, bypass valve. These are the different types of the obstruction. Then the later symptoms of the foreign body can shift from one side to the other. If the foreign body stays inside for a long time, it can move from one spot to other. There is change in the physical signs. Retained foreign body in the lung later give rise to pneumonitis. bronchiectasis, and the lung abscess. So these are the later symptoms. It can cause serious conditions like pneumonitis, bronchiectasis, and lung abscess can develop if the foreign body stays for long time. Symptoms and signs now which are associated with the foreign body at different levels. We have in the larynx, there can cause complete obstruction, lead to death. We already talked about this. Partial obstruction can cause stridor, hoarseness, cough, respiratory difficulty. Trachea can cause choking, stridor, wheeze, cough, palpatory thud, and audible slap. Then bronchi, cough, wheeze, and diminished air entry to the lungs form a triad. Respiratory distress with swelling of foreign body, lung collapse, emphysema, pneumonitis, bronchiectasis, lung abscess. So consequences depending on different sites of location are different. If it stays for a long time, then it can cause abscess, pneumonitis, and bronchiectasis. So that concludes section 2 of our lecture. Thank you for watching sqadia.com.